Hey guys, so it is May the 1st. I can't believe it's May. And May is Lupus Awareness Month. So I thought I would just come on and do this little video to talk a little bit about lupus. So first off, I want to say that May is Lupus Awareness Month in the United States. And the awareness color in the United States for lupus is purple. Now, in Canada, our Lupus Awareness Month is in October, and our lupus awareness color is red. I don't know why they're different months, different colors for different countries. It doesn't really make much sense to me because I feel like it should be one month and one color worldwide, because I feel like that would bring more awareness if it was straight across the board, the same month and same color worldwide. But despite that, the reason that I most of the time go towards celebrating Lupus Awareness Month in May versus October, even though I live in Canada, is because, for one thing, most of my viewers are from the US. But on top of that, I feel like it's more well known that May is Lupus Awareness Month. I hardly ever hear any talk about the October Lupus Awareness Month in Canada. So when it comes to doing my videos and trying to spread awareness about lupus, I tend to go with May just because it seems to be more widely known. So I just wanted to put that out there to start off with. But I just basically thought I would come on and start Lupus Awareness Month off by explaining what lupus is for those who are new to my channel and don't know what it is, or you haven't heard of it before, because it is sadly a disease that is not well known, although it is said that at some point in your life, either you or someone you know will have lupus. That's how widespread this disease is. It's on the rise, and yet it doesn't get a lot of awareness. It isn't well known. It doesn't get a lot of research. I don't know how many years ago it was now, maybe 4 years ago, was the very first drug developed specifically for lupus, and that was the first drug ever developed specifically for lupus, ever. Prior to that, it had been 50 years since certain drugs that were used to treat other things became, I guess, approved, FDA approved to use to treat lupus. But it was all borrowed medications, borrowed treatments from other diseases. But this was the first drug that's made specifically just for lupus. So what is lupus? Lupus is an autoimmune disease, and it's funny, I've explained this a lot of times on my channel, but I kind of recently, in the last week that I've been sick, I've been doing a lot of reading, and I came to realize that I was a little bit misinformed on some parts of what that autoimmune disease means. So I always was under the impression that it meant that my immune system was overactive, and therefore it would just attack healthy tissue in my body and just like wreak havoc essentially. That is kind of the case, but I kind of always had in my mind that, well, because my immune system is overactive, it must mean that I have a really strong immune system that would fight off infections and things like that. But the treatment for lupus is to suppress your immune system so it doesn't attack you, and therefore you're left with a crappy immune system, so you do catch, like, you know, colds and flus and infections easily. Well, I found out that's not the case. It doesn't mean that I've ever had a like super wonderful immune system. I mean, I guess I did until I got lupus, because I never really got colds or flus very often in my childhood. But basically, whether you're on immune suppressant medication or not, just lupus itself actually lowers your immune system, because what it means to have an overactive immune system, in my case, when it goes autoimmune, is that it ignores, it gets confused. And so instead of attacking the foreign stuff, like when you get a cold or a flu or a virus or whatever the case may be, whenever you catch stuff like that, it doesn't really go into attack mode on those things, because it's too busy attacking all the healthy tissue in your body, because it's confused. So that's what it means. And I didn't really realize that until this week, because I was just kind of, you know, with this cold I've had and the way it made me feel, I was kind of reading up on colds and lupus and stuff. And that's where it was explained better, that basically our immune system is completely confused. And so instead of going to town on the stuff that it's supposed to go to town on, like foreign things and things that are not supposed to be in your body, it just starts attacking whatever it wants to attack in your body that's healthy. It can attack your skin. It can attack your brain. It can attack your nervous system. It can attack your kidneys, your liver, anything, your joints, anything. It can just wreak havoc on anything in your body. With lupus, there's actually different types of lupus. The main one being SLE, which stands for Systemic Lupus Erythematosus. And basically what that means is, if you have SLE, that is the kind of lupus that I have, which is where it can attack anywhere in your body. There's also Discoid Lupus, which is basically lupus that just attacks your skin only, and you will get lesions on your skin, sores. And if you know the singer Seal, he had Discoid Lupus, and that is why he has all that scarring on his face. And there is also drug-induced lupus, which is, I don't know how often that happens to people, but it's where you'll be taking a medication that will essentially give you the symptoms of lupus, but as soon as you stop the drug, it goes away. So it's not like you have lupus for life. It's just induced by a drug, and it goes away when you come off of the drug. There is also neonatal lupus, and that, I believe, mostly happens to babies who are born from a mother that has lupus, and it's not lifelong lupus. It's not like chronic lupus like what I have, where it'll be with the baby for the rest of their life. It's just they'll get like rashes or little lupus symptoms at birth, but it will go away and they'll be fine. So obviously the most severe one is the SLE, because it can affect everything in your body. And the scary part is that you never know what it's going to do next. It's a very unpredictable disease, and they call it, excuse me, they call it the disease of 1,000 faces. And the reason for that is because no two lupus patients are the same. Some have it very mild, some have it very severe. You know, some people do end up dying from lupus, mostly due to complications, like if their kidneys are very badly affected, or their lungs, or their central nervous system. Or a lot of times what happens is because the patient is on high immune suppressant drugs, they will catch an infection, and the infection is what actually ends up killing them, as opposed to the lupus itself. So when you're on the immune suppressant drugs, which I'm on prednisone, and I'm also on a cancer drug called methotrexate. And that is to suppress my immune system so it calms it, so it doesn't attack things in my body. You have to be very, very careful, because a simple cold or flu can turn into something much more severe. So you have to be really, really careful. So I always have like hand sanitizer on me. I'm always washing my hands. Try to stay away from people that are sick. Stuff like that. But it's very unpredictable. Like, you can feel fine 1 minute, and like 2 minutes later you feel like crap. You can feel fine 1 minute, and the next minute you're in the ER. I mean, it's just very sporadic, very unpredictable. You don't, and you don't look sick on the outside. So a lot of people don't realize how you're feeling, and they don't realize what's going on. And that's the thing, is like, you can look so healthy on the outside, but you don't know what's going on inside the body. You don't know if it's attacking whatever organ until all of a sudden you start having symptoms, and you could be in the hospital. Like, it's just, and it's a chronic illness, meaning that there's no cure for it. You have it for life. But with lupus, it can go into remission. So what it is like, you have the chronic phase, where it's like the medications are kind of like controlling things, and your symptoms are kind of mild. But then when you have what they call a flare, it's when your symptoms get worse, and then, treatments have to be adjusted and things. Or you can get to a point where you're symptom free, and you might even be able to come off of a lot of your medicines and be fine. And that's called a remission. And remissions can last anywhere from a couple of days to weeks to months to even years. No one ever knows how long a remission will last. It just depends on the person and the course of the disease. And it's just, like I said, it's unpredictable. So that pretty much is what lupus is. It's just an immune system that has gone wacky and is confused. And it's like, it's almost in a sense like your body is allergic to itself. So it's just like, hey, this kidney shouldn't be here. Let's attack it. Hey, this heart shouldn't be here. Let's attack it. So yeah, it's kind of weird. I guess that's pretty much it. I don't want to ramble on forever, but that is pretty much what lupus is, and it's very different for everyone that has it. And like I said, no two people experience it the same way. And yeah, so it's Lupus Awareness Month, so I encourage all of you guys to join in and spread awareness by wearing purple. There's actually Wear Purple Day, which is May the 20th. So mark that in your calendars, everybody. May the 20th is Wear Purple Day. So I would love for all of you guys to make videos of you and your babies dressed in purple. last year it was really fun. Last year I had a lot of you guys email me pictures of your babies and you wearing purple for Lupus Awareness Month. So and then I like kind of put like a compilation video together on my channel. So if you guys would like to take part in that again this year, you can email me. I will put my email in the description below, where you can email me your pictures of you and your babies wearing purple. If you want to have like a picture of you holding a sign saying I support the fight against lupus, or you know, spread lupus awareness, or, you know, whatever, or I wear purple for lupus, whatever you want to do, like hold up a little sign, or, you know, whatever the case may be, that would be awesome. I know I'm not the only lupus patient in the reborn community. So there's lots of other patients in the community that have lupus too. So come on in and support everyone. So like I said, the email will be in the description below. I will also link a playlist in the description below. If you would like to learn more about lupus this month and the ways that it can affect people and the ways that it's treated, I have a playlist from about 2 years ago where I did a lupus awareness video for every single day during the month of May. And every single day I did a different topic about lupus. So if you want to go and check those out and peruse those videos during the month of May, I will have a link to that playlist in the description below for you guys to check out. And also, this month, unfortunately, there are no Lupus Walks happening in my area. For the last 2 years, I've done Lupus Walks during the month of May, and there's none this year. So I'm kind of sad about that, but I did find out that you can do like a virtual walk. So I'm going to look into getting that set up. And if I get it set up, I will be sure to give you guys the link. So if you want to go and sponsor me, you can. But in the meantime, I also encourage you to check out the link in the description for my t-shirt shop. Because I have lupus awareness shirts. If you want to get those, I have them in purple for US and I have them in red for Canada. So it will say either I wear purple for lupus or I wear red for lupus. I have onesies for your babies if you want to get those. And all of the proceeds from the sales of those shirts will go to Lupus Ontario. So be sure to check those out. And also for the month of May, my other t-shirts in my shop that are doll related, like I have Keep Calm and Play with Dolls, the proceeds from those shirts as well will go to Lupus Ontario. So all the stuff that's in my t-shirt shop, all of it, if you buy any of it this month, it's going to Lupus Ontario. So please go and check those out. And I just want to give you a note, if you're going to purchase any t-shirts from my shop, they tend to run on the small side. I've noticed that with a couple of people that have ordered them and have had to exchange them, as well as myself. They tend to run on the small side. So when you order, you might want to go up a size than what you usually would get. So just a little tidbit for you guys. Anyways, thank you so much for watching. I hope you enjoyed this video and learning a bit about lupus. And I hope to see you guys spreading awareness yourself this month and show your support for those in the community that have lupus. So thank you so much for watching, guys. And I hope you all had an awesome weekend. I'm starting to feel better finally. I'm not 100%, but I'm well enough that I'm going to be going to work tomorrow. So I think I'm on the mend, and we'll see what my doctor tells me tomorrow after work. All right. Thank you so much, guys, for all your love and support, and we will see you in the next video. Bye.